Yeah? Okay. So the idea is that we're going to start putting stress through that central section. For someone who's super tight further up, this again will be an indicator that they're tight. If they're feeling a pull higher up into that sort of sternal region. If they're not feeling anything, it might mean that things are pretty free through here, and that's a good thing. Anyway, so we'll give it a shot. So we need 2 really clean cups. And again, this one can be a bit confusing, but you've got the demonstration on the Facebook page, right? So if you forget, go back to it. Okay. So, 12th rib, just below, either side. We good? We want the head out of flexion, so if they've got a pillow or something behind their head, it needs to come out. Needs to be out. Alright, so we're going to breathe in, breathe out. As you're breathing out, this is a really good example because you're a tiny little thing. If I press down too hard, I'll feel vena cavas, aortas. You don't want to start bursting those little fellas because that's death. So the idea is that the actual pressure that you're placing is towards the toes. So as you're breathing out, the cups are going down, but I'm not jamming them down. Okay, it's just gentle engagement, and it's a little scoop. All right, and then you'll be holding your breath, and then I'll be pulling through like that. Okay. So we'll give that a shot. Do you remember this? Yeah. So breathing in, breathing out. Just a gentle engagement. Hold your breath with the breath out. Stretch. Count to 4. 1, 2, 3, 4. Breathing in, and you count out loud so that people know when they're able to breathe again.
Because the diaphragm would be up.
Hold the breath.
So you're stretching the diaphragm.
Stretch.
Kind of.
2, 3, 4. We'll do it one more time. Gentle engagement down. Hold your breath. Stretch. 2, 3, 4. Right, so we've got that timing. So to increase it and to get engagement or interactiveness with the person on the table, they can bring their arms up over their head slowly. And that takes it to the next level of stretch in most cases. So make sure you tell the person the expectation isn't to get your arms all the way through, because some people they'll go, holy crap, that will do, 3, 4. So it's not about getting your arm all the way through, it's about finding that next barrier, that's all.
Up as well.
So breathing in, and I'll tell you when to move your arms out. Again, scoop. First barrier, go. 1, 2, 3, 4, and back again. So could you feel that as you... Yeah? So we'll do it one more time, alright? Going down, scoop a little bit. First barrier, go. 1, 2, 3, 4, and back again. Do you like avocados?
Yeah.
Cool. So we got that. So first without the arms, second time with the arms. And again, if someone's feeling tightness, they'll feel it directly up through that midline, which means that after lunch when we're doing sternal work, they're going to get lots out of it. And when we're doing fascial stretch through here as well, later on this afternoon, they're going to feel it. So this is sort of the beginning of that whole opening up. Any questions?
The counter of that, because we're talking about countering what we do one side to the other, so it would be to work obviously erector spinae, the whole back before you do that?
You could, either way, it doesn't matter. It doesn't matter. In fact, this isn't so, when I'm talking about that sort of agonist-antagonist in reference to the fascial aspect, that's really important further down the line. But as far as the thorax, it's up to you on how much work you do. This is not going to affect as much the back. It is on the peripherals, but as far as the thorax is concerned, not as much. But having said that, we're going to go sideline at the end of today as well to get into that lateral aspect, and that is a really important part. The actual front and back, if you like, can be separated, but the lateral sides are really important, and you'll trust me, when you've had it done to yourself, you'll understand what I'm talking about. So that lateral aspect should be done if you're doing supine or prone, definitely. Yeah. Okay. So just quickly, again, summarise. Product on, your normal technique. See how you go with fanning. If you want to do long stroke, fine, whatever. Drop back to flash cupping as necessary. Then there were the 2 stretches that you can do. The first one up here. Second one, move the patient across, drop the leg off. Then we did that particular abdominal stretch. And then to finish off, if you do have the time, you can put product on. And instead of doing a hand clockwise motion, you can use the cup and do circles as you're going around. Okay. And as far as you're asking the question, how low can you go? Again, you don't want to really get any lower than sort of around this region. So when you're doing your circles, if you're looking at the belly button, you should be just coming underneath it and no further down at all.
Oh, okay.
Just coming into territory that's just too sensitive. Yeah. Questions? No? All good?